Hi, welcome to another episode of Physiode. Today let's discuss Dupuytren's contracture, a condition that affects the connective tissue under the skin of the palm, causing the fingers to curl inward over time. This condition occurs when the fascia, a layer of tissue beneath the skin, thickens and forms tight cords that pull the fingers toward the palm. Though Dupuytren's contracture can affect any finger, it most commonly involves the ring and little fingers. This condition typically progresses slowly, and in advanced cases, it can lead to a loss of hand function. Dupuytren's is most common among men over 50, particularly those of Northern European descent, but it can affect women as well. Symptoms of Dupuytren's contracture often begin with a small nodule or thickened area on the palm. Over time, these nodules can form cords of fibrous tissue, which gradually pull the affected fingers into a bent position. Unlike other conditions that affect hand function, Dupuytren's isn't typically painful. However, as the condition progresses, it can interfere with daily activities like shaking hands, putting on gloves, or holding objects. Some people may develop the condition on both hands, and in severe cases, the fingers may become locked in a permanently bent position. If you're noticing early signs of Dupuytren's contracture or want a second opinion on your symptoms, feel free to reach out for an online consultation via WhatsApp at 9180-8990-1223. The exact cause of Dupuytren's contracture remains unclear, though genetics play a significant role. It often runs in families and is associated with several risk factors, including age, gender, and ancestry. People with certain conditions, such as diabetes and liver disease, have a higher likelihood of developing Dupuytren's, as do those who consume alcohol frequently. Although injury or repetitive hand use has been considered as potential causes, recent research has shown that lifestyle factors and genetics are likely the dominant contributors. Diagnosing Dupuytren's contracture usually involves a physical exam. A healthcare provider may perform the tabletop test, where the patient tries to lay their hand flat on a table. Difficulty in doing so can suggest the presence of Dupuytren's. Ultrasound or MRI isn't typically needed, as the diagnosis can be confirmed through physical findings alone. Treatment options for Dupuytren's contracture vary based on the severity of the condition. For early stages, conservative management like stretching exercises, hand therapy, and splinting may help maintain flexibility. However, conservative treatments are unlikely to stop the disease's progression. For patients with mild to moderate symptoms who want a personalized exercise plan, online consultations are available via WhatsApp at 918089901223. In more advanced stages, when fingers are significantly contracted, minimally invasive procedures may be recommended. Needle aponeurotomy, for example, involves using a small needle to break the cords causing the contracture. This procedure is done under local anesthesia and typically has a short recovery period, though the risk of recurrence can be higher compared to other options. Another option is collagenase injection therapy, which involves injecting an enzyme to break down the cord tissue. Studies have shown that this method is effective in many cases, though there may be some side effects like bruising and pain in the hand. For severe contractures, surgery may be considered, especially if conservative methods or injections are not effective. Fasciectomy, which involves surgically removing the thickened tissue, can often lead to long-lasting improvement and better hand function. Another surgical technique, dermofasciectomy, removes both the affected tissue and a portion of the skin to prevent recurrence. While surgery offers the most permanent solution, it does require a longer recovery time, and there may be some risks, such as infection or stiffness in the fingers. Recent research highlights the potential role of new biological treatments that target the fibrotic tissue directly, which could offer promising alternatives in the future. A 2022 study in hand surgery and rehabilitation examined how injections of antifibrotic agents may halt disease progression, though these treatments are still experimental and not widely available. Another 2021 study found that combining hand therapy with injection therapy was effective for many patients, helping maintain hand function over the long term. In summary, Dupuytren's contracture is a connective tissue disorder that can gradually impair hand function, but various treatments are available depending on the stage of the condition. For those with early symptoms or anyone seeking a second opinion, reach out via WhatsApp app for guidance on assessment and treatment options. Thank you for watching, and remember to like and subscribe for more on musculoskeletal health.